So if you go to the next slide, the most striking finding of this report, the one that shows most prominently, comes from the growing impacts of climate change on health. And as you can see on screen, we have about 15 indicators, single bits of numeric data monitoring in time the evolving impacts of climate change on health and on people's well-being. And of these 15 indicators, we see that 10 have reached a record high level of impacts, hazards, threats, or exposures in the most recent year of data. And in that heat map that you see on screen, what you're seeing is each of those indicators graphed with colors going from blue being the safest conditions in our monitoring timeline to red being the most dangerous conditions for health in the monitoring timeline. And as you can see, that very clear gradient in time towards more dangerous conditions. So we see record high impacts across most of our indicators that are disproportionately affecting the world's most vulnerable communities, both in the poorest countries, the most vulnerable countries, but also in the wealthiest countries. It's even in wealthy, rich countries, we see that climate change is strongly affecting vulnerable populations. So next slide, please. The first thing that I wanted to share with you comes from the kind of perhaps most direct impact of climate change on health that has to do with the growing heat exposure. I've been hearing some of the testimonials that you have been sharing even before this call about how temperatures have become unmanageable, particularly for elderly citizens, for people that are living in areas without access to cooling, and the huge effect that has on their physical and mental health. So what we're monitoring here is just a very small percentage of that impact of heat on health. We're seeing heat-related death of adults over 65 years of age that we know are a disproportionately vulnerable age group, with elderly populations being less capable of controlling their body temperature, of cooling, and therefore at very high risk from heat stress and heat stroke that is potentially lethal. And we see that the mortality attributed to heat of adults over 65 years of age has increased by 167% since the 90s. You can see that graph with a very steep growth. And this has been driven mostly because of the rising temperatures. Obviously, there has been an influence of a growing elderly population globally. But as you can see there on the screen, we would only have expected a 65% increase if temperatures hadn't changed.